Welcome. Introduce yourself and go ahead.
Thank you. Chairman Hughes, Vice Chairwoman Paxton, and honorable members of the Senate Committee on State Affairs. Thank you for the opportunity to testify this morning. My name is Trudy Taylor Smith, and I'm the Senior Administrator of Policy and Advocacy for Children's Defense Fund, Texas. We are a nonprofit advocacy organization dedicated to building community so young people grow up with dignity, hope, and joy. And we strongly oppose Senate 8 because as it is currently written, it would directly contribute to violations of children's fundamental rights to freedom, dignity, and physical and psychological safety. By requiring local sheriffs across the state to enter into 287G agreements to assist ICE with immigration enforcement, not limited merely to jails, this bill would use taxpayer money to potentially lock up immigrant children and parents in inhumane conditions and to deport law-abiding families who have been contributing members of their local communities for years. ICE reportedly plans to target migrant families and unaccompanied children for detention and deportation. In line with these priorities, the Department of Homeland Security recently reopened 2 family detention centers in Texas. When immigrant families were detained at these facilities under the first Trump administration, widespread abuse and neglect was documented there. And the American Academy of Pediatrics stated that DHS facilities like these fail to meet the basic standards for the care of children in residential settings. In 2018, a toddler tragically died after being detained for 20 days with her mother at the facility in Dilley, Texas. Research shows that detained children experience developmental delays, post-traumatic stress disorder, anxiety, depression, and suicidal ideation. Instead of using taxpayer dollars to fund immigration enforcement activities that will traumatize children, including infants, by putting them behind bars, our state should spend money instead on investments that will truly improve public safety for all Texans, such as funding quality education, healthcare, and other public services. We urge you to protect the dignity and well-being of children by voting against Senate Bill 8. Thank you.
And thank you for your testimony. Welcome. Introduce yourself and go ahead.
Thank you, Chairman Hughes and Thank you, Chairman Hughes and the committee for the opportunity to provide testimony. My name is Sarah Cruz, and I am here on behalf of the ACLU of Texas to urge this committee to oppose SB8. We often hear the legislature ask what support is needed to make our communities safer, and I am here to ask that if you wish to support Texans, border communities, and improve public safety, that you oppose this bill. Under SB8, dozens of sheriff's offices across the state would be forced to enter into 287G agreements with ICE to enforce federal immigration law. For counties who enter into the agreement and have a population of less than 1 million people, they will be eligible to apply for grant funding. This means for at least 7 of the largest counties in the state, home to millions of Texans, this is a completely unfunded mandate. Harris County, who would be among the counties to foot the bill of a future agreement, previously ended an agreement citing the cost and erosion of the community's trust. The agency was spending a total of $600,000 annually in staffing to participate in the program, and other counties have incurred costs in the millions. But even for the rest of the counties required to enter into the program, SB8 doesn't guarantee all of their incurred expenses will be covered or how much local governments will still need to pay. Rather than looking for alternatives to support border communities and improve community policing and public safety, the legislature is resorting to punitive measures that lead to things like the forfeiture of community parks and rampant racial profiling of Black and brown communities. At what cost? The legislature has already allowed nearly $12 billion to be wasted on Operation Lone Star, a program that has proven to overwhelmingly arrest people for misdemeanor trespassing. Now, when the question of ramping down has started to be raised, SB8 would lead to even more resources, more personnel, and more funding to duplicate failed efforts. And not one agency has been able to state what goal needs to be reached for the state to start scaling back. How much more are we willing to put towards an anti-immigrant agenda than the needs of our communities? 287G agreements have proved time and time again that they don't improve public safety and instead undermine it. A study on local law enforcement's entanglement with immigration enforcement found that 44% of Latinos, regardless of immigration status, were less likely to contact police officers if they were victims of crime. These are just among some of our concerns, and I'm happy to follow up with more information.
And thank you for your testimony. Welcome. Since you're at the end of the table, get close to that microphone, introduce yourself, and go ahead.
Good morning. My name is Dr. Laurie Cook-Heffron, and I'm a licensed social worker, a researcher, and a university professor, and I appreciate the opportunity to speak with you today in expressing strong opposition to Senate Bill 8. This bill, I believe it exploits our communities. It takes advantage of local resources to do the work of the federal government and instead shifts resources away, diverts funding, diverts attention, diverts time away from primary duties of law enforcement. The bill will have the impact of making people feel and be less safe, be less likely to actively participate in their communities, be less likely to be watching out for neighbors, engaging with helpers when something harmful is happening in their communities. My research and my practice over the past 20 plus years has focused on human trafficking, intimate partner violence or domestic violence, and sexual assault. And it's in these areas that I'm primarily concerned about SB8. Research shows that immigrant women, regardless of their immigration status, are more likely than others to experience intimate partner violence and sexual assault, often at the hands of US citizens, and that they suffer greater consequences of that abuse and that violence than other folks. And Senate Bill 8 will make it less likely for those who experience abuse and violence to seek help for themselves, for their children, for their families, for their communities, not just from law enforcement, but from domestic violence shelters, from their schools, the schools their children attend, from community centers. It will have a widespread and a reverberating negative impact above and beyond the undocumented community. In the aftermath of recent law enforcement ICE collaborations, I spoke with a survivor about her decision to forego assistance from a local agency. And she told me, she said, "They offered me this help, but I prefer not to accept it. Yes, I needed it, but I don't accept it because of the fear that my name will be out there. So I don't ask for anything at all. I try to put up with it, and I've suffered because of it." So we know that when access to services is hindered, the consequences aren't just dire, they can be lethal. In 2023, the last year of our statewide data, 205 Texans were killed by an intimate partner. So instead of strengthening the ways we can offer protection, support, safety, this bill further silences those who've been silenced by abuse. It further isolates those who've been isolated by violence, and it further victimizes those who seek protection, support, and services. It directs taxpayer dollars away from urgent safety, health, and mental health needs of all Texans. It sows seeds of disengagement and disconnection, and it makes all Texas communities less healthy and less safe. Thank you for your attention to this important matter.
And thank you for your testimony. Senators, any questions for any of our witnesses on this panel? Very well, thank you each for being here. You're excused. Thanks, Sheriff.